Good afternoon again. As we conclude this month, this month was Breast Awareness Month. We'll just have a short talk on breast cancer. I made a clip past weekend with my sister because breast cancer is something that is very close to home to us. We lost our mom in 1990 from breast cancer. I know that it's a disease that we know that it's not common in the past. It was not common with Black people. But for our family, breast cancer was very close to home. So I was about 11 when I lost my mom. And from what I recall is that all of my sisters, I've got 3 sisters, have had breast lumps. We've all had breast surgery. And we've also, we take care of ourselves. We do the breast self-examination. We do regular mammograms, as we are also in our 40s. Then from the family history, our aunts, like the sisters, the 2 remaining sisters of my mom, both have been diagnosed with breast cancer. But because of the latest technology and basically looking after yourself, it was picked up very early. So breast cancer, yeah, it's one of the most common cancers that we know of. Obviously it's common in female. You do get it in males as well. So what are the telltale signs that you have to be worried about? So when you do the self-examination test, you are basically looking for breast lumps. Breast cancer is usually a painless lump that you can find in your breast. You can also palpate lymph nodes. The breast itself, there can be changes in the skin of the breast. There's a concept called pure d'orange, like it's like an orange peel. You know, an orange peel has got like holes in it. So your breast sometimes has that kind of a appearance. And then also symmetry of the breast. If you find that breasts are not equal, but if they are too asymmetrical, then it's something that you should worry about. So it's important to check for breast lumps, check the lymph nodes, you check the skin around the breast, and then the nipple itself. If your nipple is retracted, then that is also a telltale sign. So what are the tests? Basically, you go and do blood tests. You can go to your local clinic, your local GP. You can go to the local hospital. So if you are less than 35 years of age, they will do a breast ultrasound on you, and it can actually give direction as to what you have. If you are more than 35 years, a mammogram will suffice. Then there are a number of tests that can be done. Breast biopsy tests can be done, a true cut biopsy, FNAs can be done to detect or to check if you've got cancer cells there. And it's very important. So the most important thing is the signs and symptoms, and to pick it up early. And when you do see you do see the symptoms, then you come forward to a healthcare professional who will do the other tests and manage you accordingly. And so the treatment, it's normally surgical treatment. They can remove the lumps or sometimes they have to remove the breasts, one side of your breast, or both. So my mom, actually, I remember she had a bilateral mastectomy. They removed both of her breasts, but because they picked it up so late, she passed on anyway. There is chemotherapy. There's also radiotherapy that helps for people with breast cancer. So the most important test is a test that you do, like, you know, we say that women and men must have a breast friend, meaning that you must have a good relationship with your breasts, and, you know, be prone to self-examine your breast. So how do you do this breast self-examination? It's a very easy test. You lift up one hand, and then you palpate your armpit, all around your armpit, looking for lumps. Then what you do, you divide your breast into 4 quadrants. Then you just palpate the first quadrant, you move to the second quadrant, you move to the third, you move to the fourth, and then you do the same thing on the other side of the breast. So basically, so that you know what is there in your breast or not. And if you do this regularly, you will be able to pick up something when there is something amiss. Yeah, so let's please look after ourselves. The breast self-examination is very easy, and then, yeah, let's take care of ourselves as we close the Breast Cancer Awareness Month. Thank you.